Hello, everybody, and welcome. Happy New Year and the best of everything to you and your families. My name is Elena Sturman. I am the president and CEO of the Glaucoma Foundation. The foundation is dedicated to improving the lives of people with glaucoma. In addition to our annual funding of innovative research into the prevention and reversal of vision loss, we provide news and information for patients on our website through electronic and printed publication and in webinars such as these ones. This is our first webinar of 2023. And tonight we are going to focus on something that I think all glaucoma patients want to know. What can you do for your optic nerve health in addition to the treatment prescribed by your doctor? Our guest speaker today is Dr. Aakriti Shukla, the Leonard Lauder Assistant Professor of Ophthalmology at Columbia University, Irving Medical Center in New York City. Her research interests include structure-function relationships in glaucoma, optimization of surgical outcomes, and sustainability in ophthalmology. Dr. Shukla going to discuss and perhaps debunk a variety of lifestyle recommendations for glaucoma. As always, there will be question and answer session after her presentation. You can ask your question by entering it in a chat or in a Q&A button on your screen. We will do our best to answer all of your questions. Now, let's begin. Welcome, Dr. Shukla.
Great. Well, thank you so much for having me. I will share my screen. Great. You able to see my slides here?
Yes.
Wonderful. So thanks very much to Ms. Sturman and the Glaucoma Foundation for the opportunity to present today. The title of my presentation is Lifestyle and Glaucoma. I have no relevant financial disclosures. Here's an outline of my presentation. We'll first go over the definition of glaucoma and the epidemiology of this condition. We'll discuss management goals in glaucoma and options to fulfill these goals. And finally, we'll go over some of the lifestyle changes that patients ask us about in clinic. These include the use of vitamins to prevent glaucoma progression, exercise, meditation, and yoga, quitting smoking and whether this will help, and whether the use of marijuana can enhance their treatment. Of course, the list of questions that patients have for us is longer than this, and I'm eager to try to help some of your questions at the conclusion of the presentation. So first, a brief introduction to glaucoma. So we know that glaucoma is often undiagnosed, and about half of those with glaucoma don't actually know that they have the condition. 1 in 40 adults over the age of 40 have glaucoma with vision loss, and glaucoma tends to not be symptomatic until later in the course of disease, although some central visual field defects can be symptomatic early on, and sometimes patients with glaucoma describe symptoms such as hazy vision or glare that can be associated with glaucoma. Vision from glaucoma, at least at this point in what we know, can't be readily reversed, so it is a permanently vision affecting condition. And we know that the number of people affected by glaucoma is growing with time as our population ages. In 2013, there were 64 million people with glaucoma, and this number will nearly double to 111 million by 2040. So what is glaucoma? Glaucoma is defined as a characteristic optic neuropathy that's associated with the development of distinctive patterns of visual dysfunction. It's a degenerative disease of the optic nerve that presents to the physician at various stages along a continuum that was described here by Weinreb et al. Glaucoma is characterized by accelerated retinal ganglion cell death, retinal nerve fiber layer changes, and eventual visual field loss. These initial changes in the retina and the optic nerve are often asymptomatic. Eventually, once there's functional impairment, this can also be asymptomatic initially in its early stages and becomes more noticeable and symptomatic only in its later stages. Glaucomatous optic neuropathy is characterized by many structural features that can be seen here. These include the vertical elongation of the optic cup, narrow retinal rim thinning or notching, and localized or diffuse retinal nerve fiber layer defects. These changes are usually progressive, so we'll see worsening over time. We can also see disc hemorrhages, which are a little spot of blood by the optic nerve that show us that there's something happening in the structure of the optic nerve that's leading to some damage. Or vertical cup to disc ratio asymmetry between the two eyes, showing us that maybe one eye is further along than the other. And here in this image, you can see elongation of the cup to disc ratio, notching of the rim, and associated retinal nerve fiber layer defect. As structural nerve damage progresses, it can expand and manifest into functional damage, which can be measured by automated visual field testing. If you're a patient with glaucoma who's been seen by an ophthalmologist, almost certainly you've undergone one of these tests. Glaucoma's visual field defects typically appear in the mid-periphery initially, but they can also sometimes appear centrally at first, and they tend to be asymmetric along the horizontal midline, so along this line. And you can see that the defect down below is different from what you see up above. And this visual field, there's the inferior defect that respects the horizontal midline, which is right here, but does cross the vertical midline. And the spot here is the normal blind spot. And you can see that there's some clustering in neighboring points. So if you're at this point right here, you can see there are several points around you that are abnormal and have a defect. So this point is also very vulnerable to becoming abnormal. Reliability and reproducibility of these tests is really key. That's why you've probably undergone this test more than once to really establish a good baseline, and then you undergo this test periodically over, every 4 or 6 months or yearly, depending on the stage of your disease. And the point of this is to establish a rate of progression to figure out whether or not the glaucoma is stable or if things are getting worse. Also, importantly, if structural and functional features don't seem typical, other conditions need to be ruled out because there are some other conditions that may try to mimic glaucoma. Because of the progressive nature of glaucoma, a goal of glaucoma treatment is really to slow the rate of loss of visual function over a patient's lifetime. Essentially, we don't want any progression to occur. In glaucoma, the only proven modifiable risk factor to prevent the progression of the disease is eye pressure or intraocular pressure reduction. Unfortunately, there's no really strong evidence that lifestyle factors, including the ones discussed today, can be a substitute for intraocular pressure reduction. They may, however, be complementary treatments that one could use in addition to your pressure lowering therapy. The mainstays of glaucoma management include eye drops, lasers, and surgery. And the common goal of these management options is to lower the pressure in the eye to mitigate disease progression. However, not all patients may tolerate medications well. Some may not get their expected results from the laser they underwent, and others may be poor surgical candidates. So, for a variety of reasons, a day doesn't go by in clinic without patients asking us what more they can do for their glaucoma. They're using their prescribed medications appropriately. They underwent their laser or surgical treatments that were recommended, but they're wondering what lifestyle changes they can undertake or what complementary treatments they can undertake to change their course of disease. So we'll discuss some of these today. Are vitamins the answer? A lot of patients ask us about this. And that's maybe because vitamins for the eyes are not really a new concept. As many of you know, there's a formulation of vitamins called Preservision, Ocuvite, or Aireds that have demonstrated benefit in preventing macular degeneration. There's currently no vitamin product that is known to have a clinically impactful benefit in glaucoma. Our group at Columbia University sought to test whether a combination of nicotinamide and pyruvate vitamin supplements would have an effect on visual field in patients who have glaucoma. So what was the potential mechanism behind this? We know that prior to neurodegeneration, glaucoma affects the mitochondria of retinal ganglion cells. And these are really the powerhouses of the cells. And this can negatively impact their cellular metabolism and energy supply. Oral nicotinamide and pyruvate were given to a mouse model of inherited chronic elevated IOP and glaucoma. And we found that these vitamins prevented glaucoma in the great majority of mouse eyes. Nicotinamide is an amide of vitamin B3. It's essential for mitochondrial health. And let's take a look at these heat maps. The red arrow there shows a control mouse without glaucoma. This middle panel with the green arrow shows a mouse with this chronic inherited glaucoma. And the last panel, the gray arrow, shows the mouse model with glaucoma that's been treated with nicotinamide. This gene expression map looks remarkably similar to the control eye. So the nicotinamide was really able to prevent glaucoma in these eyes that were sort of destined for glaucoma. We can see similar findings in the images of these mitochondria. So the top image is from a control mouse, the middle image is from a mouse that had glaucoma, and finally we see an image for a mouse model of the glaucoma that was treated with nicotinamide, and you can see how much this mitochondria resembles the control mouse mitochondria. So the nicotinamide was really appeared to be associated with a good outcome for these mouse eyes. So this was a placebo-controlled, double-masked, randomized clinical trial. So patients and their treating physicians did not know whether they were receiving vitamins or an inactive rice flour pill or placebo. And we assessed many people for their eligibility in the study and ended up randomizing 42 of them either to the vitamin group or to the placebo group. Ultimately, we were looking for a 2-to-1 allocation with double the number of people in the vitamin group as compared to the placebo group. And we can see that both groups had early to moderate glaucoma based on their visual fields. So these were not people with very advanced disease. We felt that these were people that had some visual field and some retina that could really still be salvaged with a potential vitamin treatment. What we were really looking for in this study, or the primary outcome of the study, was improvement in visual function based on visual fields. And what we found was that oral administration of 3 grams daily of nicotinamide or vitamin B3 and 3 grams daily of pyruvate, both of which are over-the-counter vitamins, for 2 months led to the improvement of a few additional visual field test locations as compared to those who were receiving the inactive placebo pills. And so essentially what we found was that patients who had taken the vitamins for 2 months were able to see a few more points on their visual field tests as compared to those who didn't. So what are the next steps for this study? So this was a pilot clinical trial. And, of course, I talked about the laboratory studies as well. These all suggest that nicotinamide and pyruvate do contribute to some short-term neurorecovery in glaucoma, and that maybe they prevent the development of glaucoma in these mouse eyes that were destined for it. But these findings need to be confirmed in a larger study with longer-term follow-up that focuses on neuroprotection. So in our proposed study, which was actually generously funded by the Glaucoma Foundation, we aim to determine the effect of nicotinamide and pyruvate in addition to standard of care IOP lowering therapy on glaucomatous progression compared to placebo over a longer term duration. The initial study was just 2 months in patients with open angle glaucoma. And we're planning to do this also with another double masked randomized clinical trial at Columbia. So the research question of the study is whether nicotinamide and pyruvate can slow functional and structural glaucoma progression in open angle glaucoma over a long-term duration, and whether its side effects are safe and tolerable. Can patients realistically use these vitamins? So our first endpoint is a functional endpoint, and this is the rate of central visual field progression as measured by the sensitivity of a 10-2 visual field, which really tests your central 10 degrees of your visual field. The reason we chose this was because we feel that the central visual field is probably most important for one's functionality, and studies have shown that central visual field defects are associated with decline in quality of life. Our next aim is a structural endpoint. So we're looking for the rate of retinal nerve fiber layer thickness and ganglion cell layer thickness progression as measured by an OCT or optical coherence tomography test. If you've been seen by your ophthalmologist for glaucoma, more than likely you've had this test as well. And patients who are involved in the study are going to be undergoing these tests serially. And then finally, we want to measure the safety and tolerability of oral administration of these vitamins in patients. And so we're going to be doing this by looking at a quality of life endpoint. This is the Glaucoma Activity Limitation Scale, and it talks about various difficulties that folks with glaucoma may have in certain activities. So you kind of rate your level of difficulty with these activities, such as walking after dark, seeing at night, adjusting to dim lights, walking up steps or stairs. And then we're also going to be looking at the tolerability of gastrointestinal symptoms, which have been associated with high doses of nicotinamide in particular. These symptoms include diarrhea, vomiting. The incidence of these was not found to be significant in our pilot study, but we're now doing this larger study with more patients. So our goal is to identify whether or not this is really a tolerable supplement for folks. So here's our study design. Patients will be screened, they'll agree to participate, they'll then complete their baseline visit to confirm eligibility. And if they are eligible, they'll be randomized 1-to-1 either to the study medication or to the placebo. And then they'll be followed for 87 weeks with diagnostic testing, exams, questionnaires, blood samples to measure the level of the study drug. We're just now starting the study. Actually, enrollment will begin in just a week or two. So it's still unknown, at least based on our study, whether these vitamins will really change the course of glaucoma progression. But our initial short 2-month study on this did suggest that these vitamins could improve a few visual field test locations. Whether this is really clinically significant for the patient remains to be known. And we're eager to share our results in the next few years. The eventual goal of this study and others like it that are actually being performed around the world, inspired by our initial pilot study, is to identify therapies for glaucoma that can slow or reverse optic nerve damage by targeting possible etiologies for the condition rather than just its presentation, which is pressure elevation. Moving on to exercise. So patients are active and they like to ask us whether doing more exercise will help them. There is some evidence that's quite promising that shows that aerobic exercise may decrease the risk of vision loss from glaucoma, and that glaucoma patients with severe vision loss are actually less likely to be physically active. In this study by the Wilmer group, they found that patients who wore a hip accelerometer for 1 week to measure daily minute-by-minute activity for 7 days, they found that those who had lower activity levels and shorter, more fragmented activity had worse visual field damage. And these were all patients with glaucoma. So as you can see here in this graph, the x-axis is time throughout the day, and the y-axis is mean steps per hour. And those who had lower mean steps per hour actually had lower visual field sensitivity. And so you can see that the darker colors here, this black line, showed folks with pretty good visual field sensitivity. They had greater mean steps per hour than those who had lower mean steps per hour and worse visual field sensitivity. In another study, patients also wore accelerometers for a week to measure daily activity, and their longitudinal visual field measurements were analyzed over a period of about 12 years. They found that those who had more steps per day, more moderate to vigorous activity per day, and more non-sedentary activity per day had slower visual field loss. The rate of visual field loss was decreased by 10% in those who had an additional 5,000 daily steps or 2.5 hours of non-sedentary physical activity. So essentially, the more active you were, the less likely it was that your visual field would progress. These are pretty promising findings. And, as we know, physical activity is a pretty low risk, low cost sort of intervention. And it's also good for your overall health. And it's great to hear that it may help in glaucoma as well. Another question that we hear from patients is, does meditation have the potential to help? So first of all, what is meditation? Meditation involves focusing on or clearing your mind using a combination of mental and physical techniques, deep breathing and concentration. It has been shown to have some beneficial effects for overall well-being. It's also non-invasive and really kind of low risk or no risk. Does it do anything in glaucoma? Well, in this study of 60 patients with primary open-angle glaucoma, these patients were all taking maximal topical medications, and they were actually all scheduled for trabeculectomy. They were included in the study at this tertiary eye care center in India. And of the 60 patients, they divided them into two groups. 30 patients, group one, underwent 3 weeks of 45 minutes daily of mindful meditation in addition to their medical therapy, whereas group two continued only the medical therapy. And in this study, they defined mindful meditation as focused breathing and being attentive to the present moment. In this study, they found that in the group that had medical therapy plus 45 minutes of daily mindful meditation, they actually had a 5 millimeter mercury decrease in the pressure compared to the group that did not have the mindful meditation. They also looked at pro-inflammatory and anti-inflammatory genes in the trabecular meshwork, or the natural drain of the eye, in those that underwent trabeculectomy. So they took a small sample of the trabecular meshwork during the surgery, and they analyzed for these genes. They found that meditation was associated with downregulation of the pro-inflammatory genes and upregulation of neuroprotective genes. So overall, the conclusion is that mindful meditation is a pretty low risk, low cost activity that may help reduce intraocular pressure, may be beneficial to one's health and quality of life overall. And it may be through a mechanism in which there is less inflammation in the eye and the body. So meditation's partner, of course, is yoga, and it kind of takes meditation one step further. So in addition to concentration and deep breathing, one practices physical poses in yoga. And I often get asked, is this benefit glaucoma? Is it safe for glaucoma? Yoga is generally considered pretty safe for glaucoma, except for in positions in which the head is below the heart. So in this study, there were 75 participants. All of these folks were yoga practitioners, and they had no history of glaucoma. They were considered normals. In this study, they had their pressure checked before, during, and after a headstand. And all subjects were able to maintain a headstand for 5 minutes, except for one person. And as you can see here from this box plot, this was their baseline IOP. So before they had done the headstand, and this was about 14 or 15. This was immediately after the headstand, and this increased by about 15 points and actually doubled for most folks during the headstand. And then it remained elevated for about 5 minutes. You can see that while the headstand is happening, the pressure stays up. And they found that in one person, the maximal pressure was actually 44, which is pretty high, 44 millimeters of mercury. So and then once they were done with the headstand, the pressure actually seemed to normalize and come back to baseline. So this study and others have found that doing poses in which the head is below the heart in yoga for sustained periods of time is probably not recommended. So patients with glaucoma probably should stay away from doing headstands because we don't want your pressure to ever spike to 44. How about quitting smoking? So this is a question that often comes up. And in this study of 12 million people, they found that smokers had a higher level of pressure compared to non-smokers, and they adjusted for age, gender, glaucoma, macular degeneration, surgery, and other variables. So this was a study using the electronic medical record and lots of patient data. Sometimes studies like this are kind of confounded because this is all kind of a retrospective analysis looking at things after they've already happened. But given that there was the inclusion of 12.5 million people, this really is evidence that shows that smoking will increase your pressure regardless of whether or not you have glaucoma. There are several other studies on smoking and glaucoma, and I'll highlight one other one. This one found that smoking more led to greater thinning of the retinal nerve fiber layer, and specifically smoking more than 8 pack years, so 1 pack per day for 8 years or more, or 2 packs per day for 4 years or more, was associated with faster retinal nerve fiber layer thinning. So we know that there are so many different factors that can affect optic nerve deterioration in glaucoma, but smoking happens to be a modifiable risk factor. And we absolutely recommend that you stop smoking for your glaucoma and for your overall health. Smokers have an increased risk of developing all types of glaucoma, and we know that heavy smoking leads to an even greater risk of developing glaucoma. So even cutting down on how much you smoke could help. And then akin to smoking, marijuana is often a question that comes up in clinic. So let's talk a little bit about what marijuana is. So the plant Cannabis sativa, it has two potent compounds. These include tetrahydrocannabinol or THC and cannabidiol or CBD. THC is responsible for the psychotropic effects that we think of when we think of marijuana and addiction. Whereas cannabidiol actually is not associated with any psychotropic effects, but unfortunately also may increase the pressure in some. So THC psychotropic effects may lower the pressure in some. CBD, no psychotropic effects, but may actually increase the pressure in some folks. So the mechanism of pressure lowering in, the use of marijuana is really not well understood, but we think that there are some cannabinoid receptors that are available in the ciliary body, the trabecular meshwork, Schlemm's canal, the parts of the eye that produce the aqueous fluid, as well as the natural drain of the eye. And this may affect the production of the fluid as well as the outflow of the fluid. So here's a study that looked to see who is interested in using marijuana for glaucoma. Is this something that's really relevant? And they found that the following variables were associated, with intentions of using marijuana for glaucoma after controlling for demographic variables, disease severity, previous marijuana use. And so these include perceptions of its legality and acceptability. So people felt like if it was legal and acceptable, it was probably fine to use. They also had some false beliefs about marijuana as a good treatment for glaucoma. And then people who were dissatisfied with their current glaucoma treatment were more likely to turn to marijuana as a potential treatment option. And then finally, the relevance of the costs of treatment were something else that drove people to thinking about marijuana use. Interestingly, perceptions about marijuana safety and systemic adverse effects of marijuana were not something that people thought about too much when they thought about marijuana for glaucoma. Because this is such a popular topic, in 2010, the American Glaucoma Society, which is the largest society of fellowship-trained glaucoma specialists in the United States, made an official statement on marijuana and its use in glaucoma. So let's kind of break down this statement. So they said marijuana can lower the IOP. So can marijuana lower the IOP? So here's a few studies. So in 1971, they found that marijuana smoking by normal volunteers was found to actually decrease the pressure by 30%. Then they did a placebo-controlled trial of THC, the part of marijuana that has psychotropic effects, but can also lower pressure. And they found that the pressure was reduced by 6 points from 28 millimeters of mercury to 22 millimeters of mercury. Then later on in the 1980s, they decided to apply eye drops of THC, and they were using 1 drop 4 times a day for a week. And they found that this did not lower pressure, but it did lead to conjunctival injections. It made their eye red. And then they tried to do a crossover trial of sublingual THC on 6 patients. So a very small sample size, but they were trying to do this type of trial that may control for some effects. And they found that there was no effect on IOP, so it really didn't help much. That leads us to the question of, can marijuana raise the pressure? So cannabidiol or CBD acts as an antagonist on the CB1 receptor, and this may actually increase the IOP. And in 2006, they did a study where they found that CBD actually raised the pressure compared to placebo. And then they administered CBD and THC together, and it found that it negated any pressure lowering effects of THC. And does it lower the IOP? It's kind of controversial. Parts of it might lower the IOP that these small studies have found, but parts of marijuana may also increase the IOP. So I typically tell people that in about half of everyone, it's actually going to increase your IOP. So let's talk now about its side effects. So what are the side effects and what are some of the downsides of marijuana? So number one, marijuana is an unregulated biobotanical compound. The potency of THC has really increased over the last 40 years, at least tenfold. And the potency of the various compounds and the potential for contaminants, including pesticides and other molecules, really may vary by strain. So you don't really know what you're getting. This is a totally unregulated product. And then you have to think about drug-drug interactions, drug-vehicle interactions, teratogenicity, carcinogenicity. We really don't know what is happening when you receive that product. How about the duration of action? How long does it last? So the peak hypotensive effect of marijuana, and specifically THC, is about 60 to 90 minutes. And it has a short duration of action, only 3 to 4 hours, so really not very long. So if you were to use marijuana as a pressure lowering treatment, you'd need to use it 7 or 8 times a day. And thinking about purely just cost, you'd be spending about $53 a day on marijuana. We know that there are no well-designed studies, and there's lots of pressure fluctuation that's been seen in whatever limited available studies there are. And this may be due to diurnal changes in pressure. As we know, pressure does tend to vary throughout the day. So we don't know if it was the marijuana doing that or the normal fluctuation of pressure. So then the American Glaucoma Society said that there's a lack of evidence that the use of marijuana alters the course of glaucoma. And so at this point, it's impossible to separate the potential clinical action from the undesirable effects of marijuana. And we know that there are innumerable social effects. So after marijuana was legalized in Colorado, motor vehicle accidents doubled, there were increased emergency room visits for people who use cannabis regularly. But even if there was a non-psychotropic version of marijuana that was created, like a THC that was not psychotropic, it has very short duration of action. And few of us are able to wake up in the middle of the night, maybe twice a night, to use marijuana to lower our pressure. So it really is not a very practical option. We don't know how much of an active ingredient there is per serving. And of course, if smoked, it increases the risk of lung cancer. And smoking in general increases pressure, as mentioned before. So in conclusion, we would recommend avoiding marijuana as a compound for glaucoma. So we spoke about, multiple sort of unconventional complementary treatments for glaucoma. These are really topics that come up on a weekly basis in our clinics. And so what are the takeaways here? So vitamins, our group at Columbia is trying to understand if vitamin supplements can slow the rate of glaucoma progression. As mentioned, we are starting enrollment for our study. So hopefully we can get some information to all of you in a few years once the study is complete. Aerobic exercise and meditation may be helpful in lowering the pressure and maybe even slowing visual field progression. Yoga is probably fine for the glaucoma patient as long as you do not do positions where your head is below your heart. So avoid headstands, because the headstand can actually double your eye pressure. Quitting smoking is important for glaucoma. It's also important for your overall health. So definitely recommend doing that. And then finally, marijuana. Marijuana is unlikely to provide any benefit for your glaucoma. And as mentioned, 50% of patients, it can actually increase your eye pressure. Continued close care for glaucoma is really the best thing that you can do. So following up with your ophthalmologist as recommended, whether that's, every 2 months, 4 months, 6 months, every year, that is really very important. So you get the best care possible, and that's, tailored to you specifically. Taking your medication on time each day is also important. Getting glaucoma medications in your eye is not as simple as taking a blood pressure pill. It's hard to know. Sometimes you forget whether or not you put the drop in, whereas with a pill, you can see it sitting on your counter if you haven't taken it. So I do recommend using your smartphone or some other sort of alarm to set for yourself to remind you to take the medication. And then taking care of your overall health. So everything that we talked about, including aerobic exercise, not smoking, mindful meditation, even, all of those things really may help in altering your course of disease. So doing all that's very important. Another thing that you can do is, involving your relatives, getting first-degree relatives checked, and for glaucoma, having your children and siblings checked. That's really the best gift that you can provide to them by getting them screened and diagnosed early. So thanks very much for listening to this presentation. I'd like to thank the Glaucoma Foundation for its support of groundbreaking glaucoma research, specifically looking for therapies that'll slow or reverse optic nerve damage, including our upcoming study. And I look forward to the group's questions. And thanks very much, Ms. Sturman.
Thank you so much. What a fantastic presentation. And I know people have been writing questions while you were talking, and as of now, we have plenty of questions. You maybe you can stop sharing your screen so patients can see us better. Perfect. So I will start with questions. So first question is there a strong link between glaucoma and sleep apnea?
That's a great question. So there have been multiple studies that have looked at this, and a recent study that was published out of the Singapore group, where they were looking to see whether obstructive sleep apnea and glaucoma were linked. And they did find that there was about a 50% increased risk for glaucoma in people who have obstructive sleep apnea. So that is a form of snoring where you really actually stop breathing while you're sleeping. So that's something that can be diagnosed with a sleep study, but there probably is an association. There's also an association between obstructive sleep apnea and multiple other eye conditions, including, non-arteritic ischemic optic neuropathy, retinal vein occlusions, et cetera. So, this is something that you have. It's important to get diagnosed and then also treated with a CPAP machine and whatnot.
Thank you very much. Next question. For nicotinamide and pyruvate, how much is safe and how do you enroll in the study?
Sure. So we can provide some information on how to enroll. Maybe, Elena, if you don't mind sending it out at the conclusion.
I would love to.
That would be great. So the doses that were used in our pilot study were 3 grams per day of nicotinamide and of pyruvate. Of course, I think it's important to tailor this to your own tolerance, and as well as other medical problems. There are some people who probably shouldn't be taking these vitamins. For example, people with a history of liver disease, we're not including them in our study. Patients who are pregnant or planning to become pregnant, they're not candidates for our study. So it's really not for everyone, but the doses that we used were 3 grams per day.
Thank you very much. And to follow up on that question, would the nicotinamide pyruvate study be appropriate for someone with normal tension glaucoma?
So, we have very specific inclusion-exclusion criteria, but if someone with normal tension glaucoma may be a good candidate for our study. We definitely don't want to enroll people who have very high pressures, let's say a pressure of 40, because people like that definitely need aggressive treatment to get the pressure lower. But there's no, low tension glaucoma is typically considered on the spectrum of open angle glaucoma, and that's really what we're looking for in our study.
Thank you. And the location to enroll is only in New York City, correct?
It is only at our sites at Columbia in New York. We have multiple sites in Manhattan where you could enroll. The study requires about 7 visits over a almost 2-year period. So it's not, it's not like you're here every week, but we do need you to come in at least at this time for our study. We do have some plans to try to expand in the future outside of just here, but for the purposes of the beginning of this study, it is going to be here.
Thank you very much. Next question. If you do aqua aerobics in the morning, will that affect your IOP in the afternoon?
That's a great question. So, this kind of goes back to the conversation about diurnal IOP changes. So a lot of the studies that have looked at IOP measurements over 24 hours have found that people actually have pressure spikes early in the morning. And there are some studies now that have even sent eye care home devices home with patients so they can measure their pressures outside of office hours, let's say like at 5 a.m. when no ophthalmologist is open, just they can, measure their pressure at home. And they found that some people who tend to progress or, have their visual fields get worse over time are people who have pressure spikes at 4 a.m., 5 a.m. And so for whatever reason, their pressure is not well controlled at that time. So your question specifically about aqua aerobics in the morning, it shouldn't affect your pressure in the afternoon outside of normal fluctuations in the pressure that we know about that happen to everyone over the course of the day. Aqua aerobics is an especially sort of safe way to do aerobic exercise. So it sounds like you're doing the right thing.
Thank you very much. Next question, does acupuncture help with glaucoma?
That's a great question. So this is an area that really has not been studied enough, maybe. I think that's something that's worth looking into. Acupuncture has been found to be beneficial in a number of other fields in medicine. So it's always possible it could help. But I think you've just inspired a new research question for folks out there.
That's great. There is another question about the nicotinamide study and whether somebody with narrow or close angle glaucoma is the candidate.
Good question. So at this time, we're really only looking for people with open angle glaucoma because we feel that, we understand kind of how this disease progresses and how it relates to our initial study, which was an open angle glaucoma. But certainly the next step, if we find promising results, is to try to expand it out to other people, because while narrow angle or closed angle glaucoma may be more rare than open angle glaucoma, it's not as common. It can be more visually devastating than open angle glaucoma. So certainly one of our goals is to expand our inclusion criteria over time, but we are looking for some promising sort of results before we do that.
Understandable. Thank you so much. Next question. If you do meditation before your glaucoma exam, does that decrease your IOP?
That's a good question. So on the basis of the study that we discussed, so those folks were people who were on maximal medications, were already signed up for surgery. And what they did during the study was they continued their medications, but then did 45 minutes of meditation each day. And so, their pressure was measured either before or after their meditation. But whether or not doing the meditation before your glaucoma exam is going to decrease your IOPs, I can't say definitively yes or no, but based on the findings from that study, meditation will help you overall and maybe will help reduce stress, which potentially could have some link with eye pressure. So not a bad idea to meditate. I always tell my patients to breathe while I'm checking their pressure, because kind of holding your breath and clamming up can only kind of give you worse results and not as accurate a results. So I would say try it out and see how it works for you. Like we talked about, it's a no cost, pretty much no risk option. So it's worth trying out.
Thank you very much. Next question is a very interesting one. When working out at the gym, I have heard that glaucoma patients should avoid sauna or steam rooms as this impacts their IOP. Is this true or wives' tale?
Interesting question. So I have not actually heard this piece of advice, and I guess I can't think of a clear mechanism for why sauna or steam rooms would affect IOP. I think I would be fine to use these. Of course, you want to be careful with, contact lenses and other things that may be affected by steam or saunas or pools. So just general eye health you want to worry about, because sometimes those things are associated with corneal ulcers and all sorts of other eye pathology. But specifically for glaucoma, I don't think this should have an impact.
Thank you very much. So the next few questions I'll just combine because they all talk about yoga and positions of head below the heart. And so the first question is, could you do it for less than a minute without affecting your glaucoma? And the second is, what other positions besides the headstand that will affect your glaucoma when your head is below your heart?
Yeah, so, a very common yoga position is the downward facing dog position, in which your head is below your heart. I guess depending on how good you are at downward facing dog. I would say if you are someone who has real visual field damage due to glaucoma, I wouldn't stay in downward facing dog for an extended period of time. But if you're a glaucoma suspect or are very early in the spectrum of disease, I think you can certainly do it for like a few seconds. But as we saw in that study, pressure doubled and went as high as 44 with the headstand. So anything that resembles the headstand, I would try to stay away from if you have glaucoma that affects your vision.
Thank you very much. Next question. Does eye strain affect the progression of glaucoma?
Eye strain, such as like, for example, looking at the computer, and sometimes people have some eye strain from reading, that really shouldn't affect anything to do with glaucoma. So I always tell glaucoma patients to really enjoy their eyes and perform visually demanding tasks. That's fine.
Thank you very much. Next question. Based on your study of nicotinamide, would you recommend using it now?
So that's a good question. So, we are administering nicotinamide in these doses in a very controlled environment, and we're monitoring our patients very closely. Whether you should use it in these doses at home, I'm not sure it's the best idea. I do think that if you're going to do this, it's better to be enrolled in the study because we'll be watching you so closely. At this point, we don't know if this vitamin really has a clinically significant benefit, and we still don't totally know, what sort of adverse issues it could create for you. It's thought to be very safe, and it is an over-the-counter product. And there have been numerous other studies outside of ophthalmology that have looked at nicotinamide, but it all kind of depends on your specific medical history and medical conditions. So I would say if you have an interest in this, please reach out to us, and we would love to enroll you in our study, and then that way we'll be monitoring you very closely.
Thank you very much. Perfect. Next question. Can running for a long period of time cause high eye pressure or cause eye damage?
Good question. So there are certain types of glaucoma, specifically one kind called pigment dispersion syndrome or pigmentary glaucoma, in which sustained periods of aerobic exercise can release bits of pigment from the underside of the iris. And that pigment can swirl around all over the anterior chamber in the front of the eye and can actually kind of temporarily clog the drain of the eye, the trabecular meshwork, and that can increase the eye pressure. So, if you have this very specific type of glaucoma, pigmentary glaucoma, or if you have the precursor to that, pigment dispersion syndrome, we often ask our patients to actually exercise on their way up to their appointment, like go for a run to the office, and then we'll check your pressure when you get here. And, some people do have an increase in the pressure when they go for sustained aerobic exercise. And so we're able to check that for them. But in general, aerobic exercise and, even running marathons and all of that is generally good for your body, and it shouldn't have an effect on your glaucoma. But I think it is worth asking your ophthalmologist if you have pigment dispersion syndrome or pigmentary glaucoma.
Thank you very much. Next question. Would edible THC products have any benefit over cigarettes?
Good question. So, well, the one clear benefit is that you wouldn't be smoking. And so we know that smoking is, bad for your body. It's linked to lung cancer and other types of cancers. And we also, as discussed today, smoking probably increases your eye pressure as compared to not smoking. But whether or not these THC products have any benefit over marijuana cigarettes for glaucoma specifically, I would still say no, because marijuana really has not been shown to be beneficial for glaucoma in terms of reducing visual field progression over time, even decreasing the pressure over a short period of time, decreasing the pressure over a long period of time. So I stand by saying no, that the marijuana is probably not helpful, but it is probably better to not smoke than it is to smoke. So maybe there's some benefit there.
Thank you. Thank you very much. Next question. Does blood pressure affect IOP?
That's a good question. So this is something that's been studied all over, for decades. And interestingly, some studies have found that low blood pressure is associated with glaucoma, whereas other studies have found that high blood pressure is associated with glaucoma. I tell my patients that there isn't a clear correlation between blood pressure and glaucoma. But it is very important to kind of stay within the average ranges for the rest of your body. So there isn't a clear connection, but you don't want your blood pressure to be too low or too high.
Thank you very much. Next question. How about nutrition? For example, leafy greens, does it help?
Good question. So leafy green vegetables, foods that have high antioxidants like berries, all of those things are helpful for the rest of your body and are probably helpful for glaucoma as well. We can't say that a plant-based diet or, a diet rich in antioxidants will help your glaucoma, but we know that those things are helpful for every other part of your body. So it's probably going to help your eyes as well.
Thank you very much. Next question. Does sleeping with your head elevated help to decrease IOP versus sleeping without elevating your head?
This is a good question. So, if we don't recommend sleeping in any position that will significantly impact your ability to sleep. So if sleeping with your head elevated means that you're only getting 2 to 3 hours of sleep a night versus because you're just not comfortable. Versus sleeping in a normal position. In that case, I really don't recommend sleeping with your head elevated. In general, sleeping with your head elevated has not really been found to help with glaucoma. But there have been some studies that have shown that sleeping with your face up or face to the side is better than sleeping with your face smashed against your pillow. Consider changing your sleeping position if you're someone who sleeps with your face smashed against your pillow. But if you really can't get any sleep, unless you're in that position, it's probably more important that you get sleep because sleep affects everything else in your body.
Mm-hmm. Thank you very much. We have time for a few more questions. So I apologize in advance if we won't be able to get to every question because people have been writing ferociously and asking questions. So next question, does caffeine or alcohol affect IOP?
Good question. So there have been studies that looked at this. Alcohol can maybe lower the pressure a bit, but it's not practical to be using alcohol all the time. But certainly, there hasn't been a clear correlation between alcohol use and worsening of glaucoma. But of course, anything in excess is not great. So I don't recommend using anything in excess, whether it be caffeine or alcohol. And similarly with caffeine, the studies are sort of all over the place, whether drinking tea or coffee can help you with glaucoma. There really aren't any there isn't clearly strong evidence either way.
Thank you very much. Next question. Could you advise on weightlifting and effects on IOP?
Good question. So, again, the studies with this are kind of the evidence is really mixed. So, I advise my patients to continue their exercise and weightlifting. If you find that the weightlifting is really very, very difficult for you and you're trying to lift very, very heavy weights, that's probably not good for the rest of your body either. But there hasn't been clear correlation with, moderate weightlifting and worsening of glaucoma.
Thank you very much.
So I do think you should, I think part of that question was whether this person stopped going to the gym after being diagnosed. I think you should return to the gym, especially aerobic exercise is really important.
Thank you very much. So next one is asking whether it's important to take your eye drops the same time or it doesn't really matter.
That's a great question. So eye drops, as much as you can, try to take them at the same time each day. And then, the drops that are dosed, like for example, the nightly drops that are dosed once a night, try to use them at, the same time, whether it's 8 p.m., 9 p.m., 6 p.m. each day. And then the twice a day drops, it's important to try to separate those by 12 hours. So if you're taking them at 8 a.m., try to take them at 8 p.m. And that way you get 24-hour coverage.
Perfect. Thank you very much. Next question. While you're conducting clinical trial for vitamin effect, what can we do at the moment for over-the-counter supplements?
Yeah, good question. So, I continue to recommend to my patients to use a daily multivitamin, eat healthy, exercise. But in terms of using these agents that we're specifically studying, nicotinamide and pyruvate, I would say, do it, but you have to talk to your primary care doctor. And I don't recommend using the higher doses that we're using in our study unless you're being very closely monitored, like our folks are in our study.
Thank you very much. So we have time for one more question. This is the last question of the evening. And the question is, what is your experience with patients using the eye care home tonometer? Is it accurate? And would you recommend it?
Good question. So the eye care home tonometer has been found to be pretty accurate and correlates with in-office findings using the Goldman applanation tonometry. So in some patients who are interested in getting an eye care home, I think it is a good idea. It's not for everyone. And typically we recommend that patients do trials of eye care homes. So they take it home for a week and they measure their pressure and as many times per day as possible in that week. And then the doctors go over all those measurements. And oftentimes we're able to identify spikes in the pressure, as mentioned previously. So I think it's a great option as a trial for about a week at a time. Some patients want to buy it and check their pressure all the time. I think that's fine too, but there has been shown to be high correlation with measurements in the office.
Perfect. Well, we've reached the end of our webinar. I would like to thank Dr. Aakriti Shukla so much for doing such a fantastic job. The webinar was informative and very interesting, and I know all our audience really appreciate it. Of course, I also want to thank our audience for your participation, for your wonderful questions, for following our events. This event was recorded and it will be on our website tomorrow. I hope you enjoyed it. I hope you learned a lot. And I wish you all a good evening and thank you so much again. Bye, everybody.
Thanks so much.